Hello everyone, I am Dr. Shilpi Badani, a plastic surgeon practicing in Gurgaon. So today I'll give you some information about liposuction. Liposuction is a fairly discussed term in the media, in social media circles, and it's a fairly misunderstood term also. So when we talk about liposuction, it's important for us to understand the difference between lipolysis and liposuction. Lipolysis is basically all the non-invasive methods used to reduce unwanted body fat, whereas liposuction is a surgical method to remove body fat. Liposuction is done by a plastic surgeon, and the selection of patients, when we talk of them, the ideal patient is someone who is near his or her ideal body weight. So for example, somebody who's wanting to lose fat from the lower abdomen or the lower back and has been trying for some time with diet and lifestyle measures, exercise, but is not able to get rid of that fat, probably that would be an ideal candidate for liposuction. It is misunderstood as a weight loss technique. It is not a weight loss technique. Of course, weight loss will happen if there is fat removal, but it is not done for the purpose of weight loss. So basically, it's a body shaping technique rather than a weight loss technique. And it's important to understand that it's a surgical procedure. So a consultation with a plastic surgeon is very, very necessary. And whatever information that the patients get via the internet, because there's so many sites, there's so many information, misinformation. So that needs to be clear when you decide about the procedure. The complications, the stay in the hospital, and how much time it will take. So basically, it is a one-day procedure, but the process of betterment goes on for a while. So and there's a method to do it safely, and there are methods which are not so safe. So you have to be on the same page with your surgeon, whether what methods are being used for liposuction and what is ideal to your case. Also, it is a very, very popular procedure for targeting lower abdominal, thigh fat, in the males, the abdominal fat, and where we do high definition liposuction, for example, for six-pack creation. So all this, it comes under the umbrella of liposuction. So it's a procedure which is done under anesthesia. It is a matter of discussion whether what area is being done. So it can be done under local anesthesia, but mostly general anesthesia is preferred. The hospital stay is usually not long. So some people can leave even the same evening or maximum next day morning. The post-op visits are usually scheduled on the day 2nd, day 5th, then probably a week to 10 days, and then 2 months, 3 months. So a pressure garment is needed to be worn after the liposuction because the skin that is loose after the liposuction needs to drape, and it has to be worn for about 4 weeks time. So it is a surgical procedure. It has to be taken seriously. It is not an office procedure that you come, get it done and go. So in very limited liposuction, probably that is possible. And nowadays, even lipofilling is popular. For example, the fat that we remove, we can use it to augment areas where fat is needed. For example, in women seeking breast augmentation, it is a good method where we remove excess body fat from abdomen and thighs, and we can actually put that into the breast to increase the breast size. So it's an autologous tissue, when compared to an implant, and it is fairly safe. So it's a very popular method now, but again reiterating the initial point that it is a body shaping procedure rather than a weight loss procedure. So if you want to get a consultation with me, you can contact me via Liprate. Thank you.